Michael, what tumor markers are out there for people to really get tested and find out if my PSA is high and I'm going to go for biopsy? How do we decide whether somebody should go for surgery or somebody should go for watchful waiting?
Right. Great questions. We're fortunate now to live in this age of precision medicine. We understand tumors, cancer, like we never have in the past, and really unraveling the genetics of cancer. And I want all the listeners out there to get a pen and paper and write down some of these tests that you can ask your doctor about.
So we're going to post everything also, Michael, on Facebook and Twitter. But you're right.
Great.
Think like this one is definitely worth.
Great. And the first thing for everybody to remember, and I know you stress this all the time, Dr. Samadi, is the PSA test. One simple test. So knowing your PSA, if you can remember one thing from today's show, it's get your PSA checked no matter what your age, and we always recommend 40 to start. So what happens then if your PSA is elevated? There are other tests out there that we can look at that will help decide whether you need a biopsy, whether you can be watched, what your options are, because some of the criticism that the PSA test has received in the past is that it's not specific enough, meaning there's false positives.
Which is correct.
Right.
Because enlarged prostate and prostatitis and other things can cause elevated PSAs and as well as prostate cancer. So just so you know, Michael, in my office, I treat when somebody comes in and they don't have any family history and this is the first time they come with elevated PSA, what I do is I treat them with 10 days of antibiotics first. And I'll want to make sure that they don't have a false elevated PSA, that there's no infection or inflammation. If they repeat it and it's still high, that's when I start getting the MRI and I would get the urine test PCA3 and I start, if there's a lesion on the MRI or it still remains high, to move toward biopsy. What do you think?
Exactly. Moving down the decision tree when we get to a biopsy, as a pathologist examining biopsies, I see a lot of inflammation a lot of times, and I see many negative biopsies that don't have tumor, and we can suspect that a lot of that PSA rise can be due to inflammation. So I think starting with antibiotics first to eliminate any inflammation of the prostate so that it clears the pattern for us and lets us sort out what the problems are. So that's the first good step.